This is Professor Grodman in Psych 245 with yet another audio. This is the second, actually, the next to last audio. We'll have one, probably I will provide for you in the coming days. Today is April 19th. This one will focus on diagnoses found in chapters 14 and 15 of your textbook. The last one will deal with chapter 16. And your final assignment listed as a paper, which is actually really an exam. Given time and technological constraints, we really cannot have more than 2 or 3 papers. We had 2 already. It just doesn't work. It's too much of exchanging the information is just it's in excess, and we need to set certain parameters of time, which I think this does by doing these audios and having ultimately having a few exams. Actually, this really is only your first exam following your an exam earlier this semester. You've had two papers in between. Okay, so the exam, what will it encompass? It will cover chapters 12 through 16 in your textbook, from personality disorders all the way through mental health services, and legal and ethical issues. Chapter 14, which I'm gonna highlight some specific diagnoses, relates to and focuses on neurodevelopmental disorders, which connect and address the brain and development in terms of cognitive, emotional, and social development. For example, attention deficit hyperactivity disorder, ADHD, characterized by inattention and excessive activity. The excessive activity is hyperactivity, and also this may be accompanied by impulsivity. Just sort of hitting some of the highlights of some of these neurodevelopmental disorders. We also have a learning disorder. In the DSM-5, they refer to it as such. Obviously, it's also referred to as a learning disability. And what this constitutes is some specific impediment in learning in an otherwise bright person. For example, difficulties with reading due to transposing letters or numbers. This, of course, is referred to as dyslexia. Significant difficulty in mathematics that seems to be a function of some deficit in learning as opposed to a lack of exposure or education. This is dyscalculia. The same would be true of dyslexia. It would have to be shown that it's not due to a deprivation of information or education, but rather a biological issue or impediment. Okay, so both of these disorders, we're talking about learning disorders, and specifically there are a number of them, but we're highlighting dyslexia and also mentioned dyscalculia, are generally evident in childhood, although actually they may not be addressed or diagnosed till later on, or maybe never. An intellectual disability is not a learning disability. This is a third diagnostic term that we're using relating to this heading of neurodevelopmental disorders. And this is not a specific impediment, but rather a disorder which is evident in childhood, which is true of the others, but is global. And it deals with significant deficits in intellectual functioning across cognitive and really other domains, social domains. So you have intellectual issues such as memory, language, social skill deficits, not just one specific area, but multiple areas which are cross-domain, cross-situational behavior, and also cross-discipline. Most people who are intellectually disabled are able, though, to read and write at a basic level, but the deficits are significant and pervasive. The thinking tends to be, as an adult, rather concrete, and the ability to think philosophically, scientifically, abstractly is not achieved. And there are many reasons as to why someone may have an intellectual disability. It could be due to a neurocognitive or rather specifically neurodevelopmental disorder, such as autistic spectrum disorder, which is usually associated with intellectual deficits and certainly social deficits. By the way, statistically, in terms of autism, this is a disorder more common in males, about 4 to 1. compared to females. The former diagnosis for a high functioning person who's high function on the autistic spectrum is Asperger's. These are people who now would be referred to as having autistic spectrum disorder, but it is a subcategory of autism in which people have high IQs, or at least average IQs. And if they have high IQs, sometimes they're referred to as little scientists because of their aptitude and proclivity for certain academic areas and domains such as chemistry and physics. If anyone watched The Big Bang Theory, Sheldon is emblematic of this. He is a genius, but highly socially challenged. This is really a social deficit of an extreme sort. And think about it, the world is social. What is it you do that's not social? So this is going to really affect your life, typically in a rather significant way. Okay, other explanations for retardation. There are many: traumatic brain injuries, fetal alcohol syndrome, Down syndrome. There's familial retardation. Actually, the most common reason someone has an intellectual disability is unknown. There's no clear etiology or cause, and so it's not necessarily tied into a specific disorder. Okay, let's move ahead to chapter 15 and talk a little bit about some neurocognitive disorders. And we're going to focus on specifically going to focus, we're not going to really get into multiple disorders here, but talk more about Alzheimer's disease. It's going to be our primary focus in terms of this area. And the diagnosis of Alzheimer's disease, which is currently referred to as major neurocognitive disorder due to Alzheimer's disease. That is, let me say that again, major neurocognitive disorder due to Alzheimer's. This diagnostic category actually is a subtype of a broader umbrella term called dementia. Now, dementia involves clinical memory loss and confusion, and there are actually many, many types of dementia, but the predominance of dementias, the majority of them, are Alzheimer's. And Alzheimer's involves a progressive loss of memory, typically starting with short-term memory and eventually affecting memories that are more long-term, something that happened a year ago or 5 years ago. Actually, remote memories, things from childhood, are the ones that are retained last. One of the reasons why, if you've ever seen someone with Alzheimer's or spoken or had a family member, they may think they're in a different part of their life. They may think they're a young child because those memories are the ones that retain the longest. Alzheimer's clearly affects all aspects of functioning, including language. This loss of language is a name for it called aphasia, aphasia, aphasia. Eventually, motoric functioning. The person, Alzheimer's is progressive, and if it progresses long enough, this person may be incapacitated in bed, need full-time care with things such as eating and toileting. Ultimately, unfortunately, Alzheimer's will affect involuntary processes and areas such as breathing and swallowing, which can result in death. Most people with Alzheimer's are old. Sometimes geriatricians refer to this as the old, 80 plus, probably even 85 plus, or it's certainly 80 plus. When you look at 90-year-olds, about half have Alzheimer's. 80-year-olds, it's a much, much smaller number. So there's a real shift from 80 to 90, particularly probably even 85 to 90 with regard to this statistic in the population. And from onset of symptoms, starting with, as I mentioned before, short-term memory issues to death, something like 10 years. With especially these neurological disorders, neurocognitive disorders, there is a lot of individual variance with Alzheimer's, certainly based on the age of the person, other health factors. Currently, there's no cure, but there are medications which slow down or can slow down the progression of the disease. So we highlighted certain diagnostic terms or classifications in chapters 14 and 15. Chapter 14 dealing with neurodevelopmental disorders, chapter 15 neurocognitive. Please look for one more video dealing with chapter 16 in the text. That is dealing with ethics and mental health services, mental health delivery. And your final exam will be probably put on, I'm going to try to put it online the very end of this month, probably about a week and a half, maybe even a bit sooner, somewhere end of April, beginning of May, and give you about a week to get it back to me. I need some time to grade well over 100 well, actually, I have normal psych a little less than 100, but I have my intro classes, so to combine, it's like 150, 160 plus, so it requires a little bit of time. So certainly be aware of this, be on Blackboard, take a look at what the announcements are, so you can keep track of all the audios. Again, there's only one more, and then really your job is to prepare for the final, and once you get it, take some time. It'll be 40 plus questions, I think 45 questions to allow you to earn some extra credit on that, because people have been asking about that. It makes sense, it's a reasonable request. So you will have your opportunities with regard to extra credit on your final exam. A non-cumulative final, again, covering chapters 12 through 16, from personality through mental health issues, legal and ethical issues. Okay, look for one more audio, again, dealing with some of those same ethical issues.